Pfizer and AstraZeneca vaccines have become popular in such a short space of time in countries like Australia and New Zealand, given that they are COVID-19 vaccines. In simple and generic terms, a vaccine is a product that stimulates a person's immune system to produce immunity to a specific disease, protecting the person from that disease. Vaccines are usually administered through needle injections, but can also be administered by mouth or sprayed into the nose. A science academic from the University of Papua New Guinea defined vaccine in this way.
Vaccination is one of the processes where you introduce the body to a dead particle from a pathogen. This is causing microorganisms. And the good thing about vaccination is that it pre-introduces you to the particular environment of the live pathogenic disease-causing organism. Once you come into real contact with the organism, you are already pre-prepared. Your system is already pre-prepared, so very quickly it mounts an immune response against that particular organism.
Whilst Papua New Guinea is yet to jump on the bandwagon of the COVID-19 vaccination campaign, it is a challenge for the government and its partner agencies to roll out the vaccination campaign. This is mainly due to lack of confidence in the vaccination campaign by average Papua New Guineans as well as some professional groups, with some people saying it is not necessary. In spite of this, health authorities in the country are determined to roll out the vaccination campaign.
At this point in time, as I mentioned, we will not preempt what the vaccines that we will be rolling out. There are, the requirement of each vaccine, but the vaccines have of the 50 vaccines, the 4 vaccines have been, particularly in USA and UK and other countries, through what we call emergency use authority vaccines, and that's what had been done in USA, followed by UK. In PNG, we have Health Department being the national regulatory authority, and the process of accepting the vaccines. But at this point in time, those informations are before our government through NEC.
For us, our main strategy at the moment is the new normal or the new vaccine. But for now, when the vaccine is not here, we keep telling people our vaccine at the moment is Arim Toka. You need to listen. And when you listen, you need to make sure you follow those messages, because those are proven evidence-based strategies that have worked globally.
And globally, you have 50 vaccines on the different stage of trial. And one vaccine already approved by the WHO emergency use list, and 1 or 3 other vaccine was approved by the stringent regulatory authority. For the COVID-19 vaccine and vaccination in PNG, I have 3 messages to convey. The first message is that the COVID vaccine will help to keep us from getting COVID-19. As all COVID-19 vaccine currently available has been shown are highly effective at prevent COVID-19.
The United Nations resident coordinator says with experience of rolling out the vaccination program during the recent polio outbreak, he is confident of successfully delivering the vaccination program for COVID-19 in PNG.
So we aren't just going to get any random vaccine and start injecting it into people. Ain't going to happen. Ain't going to happen. It's not going to happen because the government will not allow it, and because the government will work with all its international partners to ensure that that is taking place. So communication is going to be fundamental, and media outlets will have to play a huge role in ensuring that everyone not only understands, allay fears, and prepare everyone to come forward, especially the ones that have a priority need. We've done it together for polio. We've done it. One of the most successful vaccine campaigns just happened in this very country just a year and a half ago. In 6 months, 3.5 million children under 15 were vaccinated, and the polio outbreak was stopped.
So what is the government's plan in implementing the COVID-19 vaccination program?
So at this point in time, there is, again, through the WHO, DFAC, and the department, we're taking consideration of 20% of the population, and the first being the health workers, frontline health workers. Then our age, what age group we should consider is the issue that the working committee, technical working committee, will decide moment the government gives the endorsement of the deployment plans that we have. And again, those with high comorbidities, like those with diabetes, hypertension. And of course, we consider those that of the extractive industries, mining, and companies that fly out our international borders. Those will be considered under this EUA.
Health authorities say COVID-19 vaccination in the country will be optional and will initially target 20% of the population who are considered to be high-risk groups. These high-risk groups will include frontline healthcare workers, elderly people with chronic underlying conditions, and those working in the extractive industries. Health authorities also say from data available, the number of confirmed cases tend to be higher in provinces which report doing more testing. There is a steady increase identified in influenza-like illnesses and severe acute respiratory infections around the country, with swabbing and testing of these individuals for COVID-19 rarely done.
We have just over 43,000 tests done so far. That's for a population of, say, 8 or 9 million. It's a very low uptake. Yes, we are working together with the PHS and the provinces to make sure that we increase the uptake of testing. You would see that a few provinces that Secretary rightfully said that have been doing the tests are actually picking up a lot of cases. So especially around the mines in Lihir, in New Island, in Octedi, but also in NCD. Don't forget NCD we still have community transmission. West Limited, we had an outbreak at the middle of December that continued until and is still continuing. And then spillover from that actually went over to East Limited and also New Island. But cases from West Limited were also detected in West Sepik. We have a new province that came on board at the end of last week, as probably you heard from the reports. Medang has now confirmed 2 cases. We expect more cases from Medang. We're just verifying some figures.
The health secretary says 4 vaccines from the COVAX facility are before the National Executive Council in the approval process. But what does the public think about the government's vaccination program? The general public have expressed mixed views in various ways via social media and through professional platforms. Some are having doubts about the disease actually being in PNG and also not having confidence in the vaccines. EMTV News spoke to some of them.
Meeting awesome. This like sickness, it's a created sickness. You know, sickness where mi plus tumpuna belum mi plan generation belum mi plan no got this la sick. So something well China like testing this la something lo all man or this la kind number so also testing this lo country blow liat. Mi plan Papua New Guinea so far no got plan dia die come up lo COVID-19. So all like testing mi plan Guinea pig blow na all but testing this la product blow lo mi plan. So think lo me against lo this la something.
Yeah, well, I'm all right. Me can use him, but the first thing first, all you need lo testing me past time. What a minute up lo kiss him nothing without test.
Me no like lo kiss marasin kam lo naraplap. Me no feel confident lo kiss him marasin. Unless supposed to talk good, explain him good, marasin will make him osanem kamososanem. I think I'm all right lo mix him, but else it's not necessary to lo mix him.
I don't really think that COVID-19 is that's a real disease that coming into our country. It just I don't believe in that.
But others think it is necessary to take part in the vaccination program for protection purposes.
It is a must, you know. We should have it, you know. We should have some here in Papua New Guinea to stop the spread, because, you know, if it spreads to people like my age group, certainly it's going to be devastating. You know, it's going to kill a lot of people.
Yeah, mi ba mamas lo kisim marasin. Na ol pikinin itu ol pikinin na imi ol gata man meri sapa so semol kam tok lok simon pla marasin kam na baol gimim lo imi mi pla baol gata ma mas tasol lo kisim lo protectim imi.
Certain scientists in the country have expressed that Papua New Guineans seem to have some natural immunity to COVID-19, in which they say vaccination can only be rolled out if really necessary and if enough data is available to prove that vaccination is required.
In simple terms, vaccination is only given to the group of people that require vaccination. According to what I said, we have certain level of immunity, and it's okay. You can get vaccination if you do not have some level of protection.
Health authorities, however, disagree with this and say the SARS-CoV-2 virus, the virus that causes COVID-19 disease, does not respect race, color, or religion.
When people are saying that we are immune, that's not true. So we are for us we are working as if we are in the same exposure as probably other countries. As you can see, the Americas at the moment are almost over close to 50 million, now 45 million. Our region is probably the lowest region with the number of cases, but with global travel, we are at the exposure and the risk as everybody else.
Certain members of the public also expressed concern over the whole vaccination campaign, saying it may have underlying motives.
Nungut baksat lo disla vaccine ikat not all papers or something where all like testing law. Something nungut tempai lo COVID-19. Nungut ikat not recent or just product come na all like testing bla.
And so many questions still remain at this point in time on the COVID-19 vaccination program by the government and health authorities. Is vaccination really necessary for Papua New Guinea? Which vaccine will be administered on Papua New Guineans? And are the vaccines under the COVAX facility safe for Papua New Guineans? These questions will have to be dealt with by relevant authorities in the coming weeks and months.